Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 267th episode, we have a great guest from Chilmark Research, Elena Lakovleva. Welcome to the show, Elena. Thank you.
Hi, Justin. Thank you so much for having me here.
You got it. So you're dialing in a little remotely, and we'll probably get to that here in a moment, but where'd you grow up, attend school, college, all that good stuff?
Well, I'm quite an international person. I grew up in St. Petersburg in Russia, and I graduated from St. Petersburg State University, majoring in sociology. And then I got my master's in Germany in Free University of Berlin that was in international affairs.
Excellent. Very cool. What kind of drove you into that path of life and studies?
Well, it's hard to say. I'm always a curiosity-driven person. Mm-hmm. So whatever I find interesting, that's pretty much a green flag for me. That's where I'm going to go. Okay. And in sociology, I just realized that the whole structure of society is a foundation for all the changes. So in other words, if you really want to understand all the dynamics that are happening on the surface, you really need to look into some foundational things and look back how it all, how it was all evolving and developing. And I think in general, sociology is a great place to start. It was not specialized too much, and it gave me, a very broad spectrum of things to choose from. And I was specialized in intellectual capital on my faculty, and I just found it very interesting. And then I just naturally followed my childhood dream, and I just wanted to go into international affairs to find out a little more. It was at the time of the Crimea crisis, and I just wanted to understand more about all those unfortunate circumstances and territorial developments. So I just decided to go to school and go a little deeper with again the theoretical component of international relations and case studies, so I could develop my own perspective.
That's fantastic. And Yakovleva is a Russian name, or what is the background there?
Yeah, so actually the literal translation to English is Jacobs, because Jacob in Russian is going to be Yakov. Yeah. And the ending Leva, it means pretty much the daughter of. So Yakovleva is the daughter of Jacob. So that's an exact translation. This last name actually of Jewish origin, even though it sounds Russian. Again, it's due to a very complicated history of my country and a crazy mosaic cultural exchanges that've been happening over many, many centuries.
Yes, love it, love it. So tell us about your path that brought you to Chilmark.
Well, I was looking for a very new type of job that I've never done before. I've been in revenue cycle on provider side for good 12 years, 11 before I joined Chilmark. And I just started to feel like I wanted to make a bigger impact. I was facing same issues over and over again from one vendor to another, from one payer to another. Mm-hmm. And finally, I realized that I was not in a good place to fight all those issues. And I started to look for pretty much like a deep research position. And I was looking for this like perfect position for probably a year. I was interviewing companies. I was looking for that one perfect spot. And I found Chilmark. And obviously, after my first interview with John third, I felt like that's the right people, that's the right mission statement. And then I had an interview, the final one, with John Moore II, who is the founder of Chilmark Research. And unfortunately, he passed away yesterday. And I just fell in love immediately with his experience, with his perspective, with ultimate independence on research, and no place for speculations or any kind of like bias in the research Chilmark is doing. So I just realized that was the place I was looking for so long. And obviously I'm still with them, and hopefully I'll be there for many, many years to come.
Yeah, Chilmark has such a great reputation in the industry. I think you're founded in 07, is it? It was, I think about 15, 16. Yeah. But phenomenal organization. I've had John Moore III on several times, my radio show, and several members from the Chilmark team. So yeah, just a great organization. And it's I'm glad you're here today. What we're talking about, hospital at home. Very excited about this, about the research and this burgeoning field. But also, before we dive in there, what brought you into digital health? This is always a great story how people find themselves or make their way into digital health or health IT. So I always love this question.
What I find, I always being asked this question from these grounds like, oh my God, healthcare is so complex and just so bad. How do you work in healthcare? So that's what I'm usually being asked. And for me, it's such a natural choice. I'm from a medical family. I've been working in in the healthcare system for so long. And I feel like I was even born, in health system, because when my mom is a physician, she worked in emergency medicine. And whenever she couldn't find anybody to live me with, I would always go to her work. Like I was 4 and 5 and 7 and 9. And I would just, spend time at the hospital or like emergency, like medical stations. And I enjoyed it greatly. And I saw all this hard work. And, quite frankly, it was, I'm 34, and that was back in the, 90s, like middle 90s in Russia. And I just saw how hard they worked. I just saw how those people were trying to truly help their patients with very limited resources, trying to do their best. And I was always asking those questions, like, why can't you make something better? Like make that EKG smaller,
right?
Or have 15 thermometers instead of 1, or to have more medications to help your patients easier and better and quicker. And that was pretty much a rhetorical question back then. But now we do have plenty of answers, and that's actually why I love it so much. Absolutely. And, that's a huge privilege of living in 21st century for sure, even though we'll have some romantic aspirations from 19th century or 18, but realistically, I'm just looking around and I'm thinking, oh my God, it's a blessing that you can actually be in this place where you can do stuff.
Absolutely. Absolutely. So as a leading industry analyst, what trends most excite you now in healthcare innovation?
Probably the most exciting for me personally, even though it's not the biggest trend, but I'm really excited to see what's going on with RCM. I'm talking prior authorizations. I am talking about very convenient ways for patients to pay their bills. I am talking for all these price transparency initiatives when patients can actually see upfront right? All the costs of the care and some of the shoppable instruments that we have now in healthcare.
Yeah.
I would not be super hopeful, but we we have some versus like 10 years ago, it was
Sure.
almost none.
Yeah, no, I completely agree with you. I mean, I'm going to have you back on air because those topics specifically are very near and dear to my heart. So good,
Mhm.
good faith estimates now across the industry. Certainly, I work in the lab space, so seeing that to come to fruition, obviously the patient pay and prior authorizations, those are right up my alley as well. So we'll do a side segment on those topics here. Maybe in a couple months. So that's great. I love it.
Awesome.
So
Yeah.
today, though, I mean, diving in a little bit to the hospital at home, your trends report that just came out, tell us a bit about that. Tell us what your findings, some of your research, and I had a glimpse of it. I love it. It's excellent. So I have some follow-up questions, but tell us a little bit about your research there.
Oh my God. I can talk about it for hours and hours. So please stop me.
No.
Thank you so much for asking this question. And also, I just want to thank all the people who were talking to me over the course of my research. Always happy to talk. And we have amazing community, as you probably like for sure,
Oh,
you know
oh
that.
yes.
And that's one of the benefits of being in digital health. So hospital at home again, so it just interlinks with my life so much because my mom was working in a hospital at home care delivery model 30 years ago, and I saw it in action back then. Very poorly executed, but the idea was almost the same. So when I was given this topic, I just I was like overexcited. And actually, the research took a lot of time. And I think we all right now just see it happening finally after all those years of discussions and talks. And we probably all know all those stories from John Hopkins and how it all began like a century ago.
Mm-hmm.
But we were waiting on execution and actual deliverables. And right now, it actually happening. So that's the most exciting part. You as a patient, you can just go to the hospital that have this model
Mm-hmm.
and be home and have medical care instead of being in the hospital. And I think that's the main achievement of hospital at home right now, that it made it to the ultimate receiver, to the patient.
Mm-hmm.
Another few interesting facts is I realized how different and diverse our country is. So we all think, talking about technology, we usually think that New York is the entire country. And then you go deeper and you realize, like, no. Country is so much bigger, and the problems are so much different from those in big cities where we have like a lot of technologies and a lot of possibilities in terms of like connectivity and some others. And what I see is that a lot of companies, they are still trying to solve connectivity issues with remote patient monitoring, remote physiological monitoring devices, and even telemedicine, and all the digital component that's going to be connecting patients to the provider centers or hospitals. That part still need to grow a bit to actually say, yes, as a country, we have hospital at home care model.
Mm-hmm.
So that's probably, please go
Yeah,
ahead.
no, thank you. I mean, I guess so, do you think this model will be the norm in the near future?
I think so, yes. So I do see that a lot of providers are still hesitant.
Yeah.
And I do see a lot of pilots. And when I precisely look into the pilot size, it's one patient. So we see a lot of providers doing it, but when you look closer, like they have 5 patients enrolled, like or one patient enrolled.
Mm-hmm.
I think that's because the market is still very, very immature. The market of solutions, the market of devices in general. And I think a lot of provider organizations, they just don't want to spend yet. but I'm sure it's going to grow. I mean, my forecast, like for until 2028, shows that it's going to grow like 3 times.
Yeah, I think it has to be. I completely agree with you. I believe it's got also not only the technology and affordability, but also the use case. I mean, I think we got to find the right use case to make sure that type of, disease state or whatever, issue is happening can be treated in a remote facility. And obviously there's lots that can be, and I totally support this model. I think it's very, very smart. But back to what you said, the technology innovation needs to be there. The care models have to be there. The integration has to be there from a data perspective. It can't just be in isolation. So there's a lot of pieces, but I think we're moving, from what I've learned. Even my friend John Halamka's done a lot of work on this. And we've even talked a bit about on the radio show as well. But I do believe this is this is the future. Like you said, it's absolutely the direction we're going as a country, even, globally. And we're beginning to perfect it in a lot of ways. So I agree with you.
It's happening.
What are some of the challenges that we're going to face? I talked about a couple of them, but what are your thoughts on challenges for the hospital at home?
I think there are a few big ones that I see. First challenge is actually staffing, and I do think that we need to dig more into what's going on with clinicians in the United States. And I hear a lot about burnout, but I am confident that the way burnout's being described and being interpreted, it's a wrong approach in the medical space specifically. I'm sure it's quite different from other cases, and I think we need to treat it as a separate issue and address it in a very unique way. So I think that's one. Second piece is just overall economy state that bothers a lot of people and a lot of buyers of the solutions. And I just think that we need to get through it. So maybe like in 2 years from now, it's going to be a lot of fresh air, and it's going to be much, much quicker in terms of like how many of IT solutions providers going to buy, what can they afford, and so on. And also I am waiting for the reimbursement policies for hospital at home to get more stable, more clear, so just providers can count on them and have a much more stable models when they start implementing hospital at home. Another issue, most likely for many, many, many providers, is that they need to keep a steady number of patients enrolled. Mm-hmm. So when we launch hospital at home program, we invest a lot, we train staff. Usually there's going to be like additional hires specifically for this program. So we need to make sure that we have a stable number of patients. And how to ensure you have that stable number of patients? You need to expand the range of diagnoses you can treat at hospital at home. And that becomes one of the major issues for a lot of companies who are doing hospital at home themselves. So when they choose to actually use their own solutions, homegrown solutions, or just assemble, their like technical foundation for hospital at home using a number of vendors. So for them, one of the main issues is actually to make sure that they can successfully and safely treat those patients with many conditions at the comfort of their homes, to make a stable number of patients enrolled, and to make this program sustainable. So among those providers I'm talking to who just starting, I think that's the main barrier for them. And after they overcome this barrier, it goes like a snowball. The more patients you can treat, the more stable the program is going to be, the more you invest back into this program to expand it even more.
That's actually a great analogy. That's very encouraging. For those that may join us a little late today, my special guest is Elena Lakovleva from Chilmark Research. So going back to your research, we got about 5-6 minutes or so in the show. Any left for this episode? Do you what are one or two things that we could call out that my audience would be, oh, wow, that's encouraging, or that's really interesting? What do you think would be one or two pieces from your research that's kind of like groundbreaking, earth shattering, or most interesting?
I will go with something that was actually on the surface, but still a lot of people just don't see it. You mentioned John Halamka, who I respect a lot for all his hard work. And in one of the interviews, he was saying that Mayo Clinic is going to be getting a major part of their revenue from digital health, right?
Yes.
I think it's one of the major twists in thinking in modern healthcare. When a lot of people, they're just holding back, they're saying like, oh, yeah, wait, let's wait for 5 years. Let's wait for 10. And then they're losing momentum. And we see what we see happening with hospitals in the past 5 years. I think that the time got so much quicker. So it's very condensed time that we're living in right now. And I think the ability to notice trends, to actually be able to believe that you can do it with limited resources right now, is most important, to be on top of your game. And investments in digital health, for sure. I mean, it just, that's the new reality. That's the way that all the hospitals should be taking. And it's going to be fruiting pretty soon. So like maybe those investments are going to be big, but the return on them is going to be really great.
I love it.
Second, and second is, I just think talking about hospital at home, I had no idea how popular it was. Actually, so many entities doing it, from payers to employers to providers, they're just not saying it. They're not calling it hospital at home. But when you dig deeper, you just start seeing it. Okay, so they've been doing it for like 15 years. Those guys have been doing it for 10. And they've been pretty successful. They're just not talking about it. They're not saying, like, oh my God, finally, we are the first implementers or anything. They're just, keep on doing it quietly. And they're getting all the benefits from hospital at home that are pretty much proven. So I think that is very interesting.
Yeah, no, that's fantastic. And yeah, John's a great guest, a friend of mine, but also I love John. He's actually my most frequent guest. So the fact that you also brought him up in Mayo and what they're doing is phenomenal. I have one last question, probably time for one last question. What are some of the things that you do to work your best and make a difference?
I always put myself in the shoes of the patient, always. Just because I think that thinking about patient first will make us all win. And I talk to patients a lot. Sometimes I'm a patient myself. Yes. I drive in Ubers. I always talk to drivers. And the question they all love is like, oh my God, how are you feeling today? And then the story begins. So I try to talk to as many people as I possibly can about their healthcare experience in the United States. And some stories, they actually come from abroad. They come from India, they come from Europe. And I'm just trying to compare experiences, even though systems are very different. But I think that we cannot deny that world is getting global. So I'm just trying to think what it's going to be in 12 years, in 20 years, in 30 years from now. And I'm trying to think how we can all contribute to ultimate well-being of all the patients in the future.
Yeah, fantastic. That's a great answer. I got one final question that I try to ask all of my guests. Where do you invest your time, talent, and treasure, and why?
I always invest everything I can in relations with people. I think that is the most valuable thing in life. I was 15 and I really wanted to have my car, and then I bought it. Then I really wanted to have a fancy purse when I was like 16 and I bought it, but it never gives you fulfillment and joy, progress, and very genuine feeling of inclusion. And I think that actually that should be your ground, and that's what you should be investing in. I think Viktor Frankl said that you have to invest in those things that you have after everything, like after your whole house got burned, right? So you're gonna have actually people who manage to escape yourself, your experience, and your relations with those people. So I truly believe in that.
Yep, I love it. Elena, you're a great guest. Thank you so much. I'll certainly have you back on air. I'd love to talk about RCM and that whole revenue cycle strategy and the other components you brought up soon. But thank you so much for joining us today.
Wonderful, Justin. Thank you so much for having me here today.
You got it. Thank you very much. And thank you to everyone for joining us. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are posted at iTunes, SoundCloud, iHeartRadio, Spreaker, and TuneIn. And also, you can check out some of the new content we just posted at justinbarnes.com. Thanks, everyone, and stay safe.